Cassie, thanks. Oklahoma health leaders keeping an eye on New York after wastewater samples there test positive for traces of polio.
Well, it sounds scary. Polio, of course, a very highly infectious viral disease that affects children mainly 5 years old or younger. Joining us to talk about how polio could impact people's health, Dr. Douglas Drevitz from OU Health. Dr. Drevitz, thanks for joining us here at 9:30.
My pleasure. Thank you for having me.
Let's just talk a little bit about the detection of polio and the wastewater there in New York. How concerned should we be here in Oklahoma about this?
Well, fortunately, it's not here. It's remaining in New York City. There is a lot of wastewater testing going on, so I don't think that we have any fear of it being here now. It certainly tells us that it can come anywhere. And it was more than likely a travel-related case in the sense that somebody who had received the oral polio vaccine then went to New York City. They were still shedding it, and that's how it got in their wastewater. It does want us to make us remember that we do need to make sure that our children are vaccinated against polio.
If folks are traveling to New York and maybe have some extra concern, what symptoms should they be keeping an eye out for?
Yeah, I don't think that most folks need to be concerned about traveling to New York City. Most of the time when you get a polio virus infection, you don't know it. Only a fraction of the true infections actually go into the central nervous system and then cause the disease that we know of polio. If you've been vaccinated, you're good.
Let me ask you, though, how is polio spread? How can you prevent it, maybe other than getting vaccinated, from getting the disease?
Right, so it is spread through wastewater. We call it the fecal-oral route. It's a little disgusting to think about, but that's really how it's transmitted. It's a virus that lives in our intestines and is spread in the environment in our stool. In many situations, it's a disease of poverty and, of course, sanitation. So thankfully, we have good sanitation systems here in this country. The other thing to remember is that the vast majority of us have been vaccinated, usually as children. And so sometimes you need to get a booster if you're going into certain circumstances. Like I received the oral polio vaccine when I was a child. That vaccine is no longer given in the U.S. since 2000. But before I made an international trip many years ago and was doing some medical mission work in Kenya, I received a booster of the inactivated polio virus. So there are circumstances where you do get a booster.
Dr. Drevitz with OU Health. I think we'll leave it there today. Good information about this right now, kind of contained in New York, it sounds like.
Yeah, thanks again, Dr. Drevitz. We appreciate you.
My pleasure.